everyone. Thank you for joining us today on Facebook Live. On Fridays, we normally have Dr. Ashley join us and talk about all things health related and COVID, but given the new order that goes into effect on Monday, we wanted to take a moment to kind of answer any questions from business owners or employees. So with us today, we have Michelle Scheichels, who has been part of our team here that has crafted the guidance for businesses, and she will be able to answer a lot of your questions. Before we get started though, we would like to just remind everyone that all the business guidance is online. If you go to como.gov/coronavirus, under health resources and official documents, it's right there under recovery and reopening. And we've shared that on our Facebook yesterday. You can find that link as well. We will also do our best to add it to the comments later. So before we get started answering questions, I would just like to take a second to kind of walk us through the process of what went involved in kind of crafting this document. You know, it's 50 pages of guidance for businesses. It's broken down by the different sectors. What was the process for that?
Sure. The process for crafting the document, or the process for really our approach?
Let's go with approach first.
Approach. Okay, to start off with our approach, there really are, if you put it into buckets, 3 different approaches that you can use to address COVID-19. So the first option you may hear about is keep everybody home, everybody stay home until we see no cases and we know it's clear from the environment. And the drawback of that approach is, of course, the large economic impact. And another approach is really on the other side of the spectrum that says open everything up, let people go about their daily lives the way they would, and try to establish herd immunity that way. The drawbacks with that approach are, well, really 2 main drawbacks. The first being the impact on health. So you see a significant number of cases, a significant loss of life, and then the other main impact is just the economic impact. When you have a big loss of life and you have a lot of people sick, a lot of medical bills, the economic impact of that is very great. So it's actually the largest economic impact that we see out of all 3 scenarios. And the last scenario is kind of the happy medium. So it's doing the close down for some time, watch how things are going, assess capacity, and then slowly reopen. And that's the approach that we're using here. That's the approach that is used around the country and around the world for the most part. I think there's only one country that I can think about that is using a different approach.
Yeah. So before we get into questions, what are kind of some of the highlights under this first step of phase 2 in the slow reopen process?
Sure. So the highlights of this first step is that businesses will begin to reopen. Most of our businesses will begin to reopen with some capacity limitations. And there is new guidance on gathering size. So now gathering size limits are limited to 10.
Yeah, and just so everyone knows too, we do have the order right here in front of us.
Yes.
We have our FAQs just so we can reference the exact numbers for you all as we go through this today. I know there are a lot of numbers involved, and so it can get a little confusing, but we're gonna go ahead and break it down by the different sectors of business. So we'll get started with churches and religious services, any places of worship. What are those occupancy limits?
Sure. So under the order, churches can expand. They were already open, but they had a limitation to 10 individuals. So now they can increase their capacity to 25% of their area. So if we're looking at their sanctuary, 25% of their sanctuary capacity, and that does not include staff.
Okay, awesome. And then let's say a church wanted to have some sort of outdoor service, because I know a couple of them have already kind of beginning to do that as far as parking lots and that sort of thing. What would the order mean for outdoor services?
Yeah, so for outdoor services, we're asking churches to submit their plans to us so we can look them over and help them create a safe plan to move forward. We have a lot of guidance in our business guidance document that you referenced at the beginning, and there is a section specifically for churches. So what we ask is start with the guidance that we gave, and that was for indoor services, and adapt that to your outdoor setting, and then send us an email businessguidance@como.gov, and outline how you're going to do that, and we will work with you to make sure that you're keeping your members of your congregation safe. One thing I do want to mention with churches is it's going to be so important for them to continue to protect their vulnerable members of their church. So we are encouraging throughout this slow reopen process all members who fall into our vulnerable population, so people who are 65 and older, people with medical issues, to continue to stay home and to social distance to the greatest extent possible, and really to only go out when you need to get when you need to go see the doctor or something like that, to avoid mass gatherings. It's going to be very, very important for them. We still don't have effective treatment or prevention, so we really want to keep these people safe, and that's the only way we can do that.
Yeah, and just a reminder too for everyone, the order does go into effect on Monday, so this weekend things are still going to be closed for the majority of time, but we're looking more so at next weekend for churches, restaurants, all that sort of thing.
Yes.
All right, so let's move on to restaurants. What are the capacity limits for most restaurants?
Yeah, so the capacity limits for restaurants are 25% of their capacity if they are larger than 10,000 square feet, which I'm not sure we have many restaurants that would fall into that category here in Boone County, but that would be 10% of their capacity. And that, again, does not include staff. And then for outdoor seating, it is 25% of that capacity. Now, for restaurants, they need to make sure that they are continuing to socially distant. So staff, and when they're seating people, so they'll be seating people at every other table to make sure that tables are 6 feet apart.
Awesome. Let's get into personal care. I know, personally, I'm ready for a haircut, but a lot of people will. And this order does allow those personal care facilities to open up, but what are some of the safety restrictions on that?
Yeah, so personal care is really unique because it requires close contact. So when we look at the risk of exposure, we take special consideration for these close contact services, so hairstylists, barbers, massage therapists, they would all fall into this category. So for them, we require them to wear a mask, and then to encourage their customer to wear a mask to the greatest extent possible.
Yeah, and then for these hairstylists, I know it's kind of come up, even if you are wearing a mask and your client's wearing a mask, there is a chance for transmission, or you would be considered a close contact if that client were to become positive later.
Yes.
Could you explain that a little more?
Yeah, so I'm going to back up a little bit and just talk in general about what happens when there is a positive case. So when there is a positive case, we work with that individual who tests positive to identify people who they've come in close contact with. And those are people that they have touched, that they live in the same household with, or that they have been within 6 feet of for a period of time. So that wouldn't include like somebody they passed in the grocery store. That wouldn't include somebody at Hy-Vee or Target or Walmart that checked out their groceries. But it would include their hairstylist or their nail technician or something like that. So that's why it's important for the additional limitations on group size for these close contact individuals, is because whenever anybody that they serve, if they show up later to be positive, we need to do contact investigations with all those individuals and make sure that they are quarantined.
Yes, and you described why the restrictions are important, but if we could just go over, I believe it is 10 people or fewer in a single location, or 50% occupancy, whichever is lower number.
Yes.
Okay.
Yes, and that again is to allow us to be able to effectively do this contact tracing that I was talking about. And contact tracing is an important aspect of reopening. It's one of our core aspects that we look at to make sure that we're able to move to the next phase. And so we really want to make sure that we're able to do that. We're also working with the state and here locally to identify more contact tracers to increase our capacity in that limit.
So we're going to switch gears just a little bit from what can open to what still needs to be closed right now.
Yeah, so large venues, bars, playgrounds, those still need to remain closed.
Why is that?
Yeah, so what we look at is places where we can socially distance and places where we're not likely to socially distance or we can't put those restrictions in place.
I know describing timelines is a little difficult right now because things will, as we go on, we'll understand more about what we're looking at, but the plan does have capacity limits through, so when do you think those large venues would be able to open, or what criteria until we can?
Yeah, so as we move through the reopening phase, our gathering size limits will continue to increase, and they'll do that slowly, and with caution, and we'll be looking at epidemiological data as we go through the process, but they will begin to slowly increase, and so that's what we'll be looking for.
Yeah, and we do have that plan on our website under that recovery and reopening. There's a set of probably 4 or 5 documents on there right now for everyone to look through.
Yeah.
Let's talk about swimming pools. So those are part of the order. They can reopen, but there are some restrictions on opening. Can you talk us through those?
Yeah, so for swimming pools, if they're unattended, we limit to 10 people, and those people need to practice social distancing, so they need to remain 6 feet apart while they're at the swimming pool. If they are attended, they need to still maintain social distancing, still maintain that 6 foot distance between all individuals, and that attendant, that lifeguard, would be responsible for managing that to make sure that people are maintaining that social distance. And before any swimming pool reopens, they need to contact our environmental health staff and submit a plan, and they'll review it and come out and do an inspection.
Yeah. Let's talk about if someone is currently working from home. Should they report to work on Monday? What's that going to look like for those people?
Yeah, if someone is currently working from home, we encourage them to the greatest extent possible to continue working from home. We want to get our businesses open, but we know that if we can continue to keep as many people home and limit the number of contacts that people have, the safer we'll be, and the more quickly we can move through these phases.
Sorry, I was putting a link there in the comments for somebody
okay.
to the document. So let's talk a little bit about enforcement.
Sure.
How will this order be enforced?
This order will be enforced like our other orders. It's complaint driven, and punishment for violation is the same as in other orders. It's a fine or imprisonment.
And then what should a customer do if they are seeing that a business is not following some of these safety guidelines?
Yeah, well, I've had conversations with a lot of businesses in the past, the past few weeks for sure, but a lot in the past 24 hours here. And it sounds like businesses are really, really trying to make an effort to keep both their employees safe and their patrons safe. And so they're, from what I have heard, their intentions are very, very good. So I would say first and foremost, if you see an issue at a business, let a manager know, let the owner know, because they may be able to quickly address the problem. If it's something that you think requires additional attention, feel free to call 875-CITY or to email city@como.gov, and we can work with the business to get things corrected.
Yeah. And then, so let's say that a business has gone through our guidance and they still have some questions, they're not sure on some things. How can they reach out to us?
Yeah, they can reach out to us by emailing businessguidance@como.gov.
Awesome. And I put that link in there too for the email address, so feel free to email us with any of your questions. Someone's asking about gyms and fitness centers. Can you kind of go over the guidance for those?
Sure. So gyms and fitness centers can reopen, and they need to follow the capacity guidelines that we've mentioned for other facilities. So it's that 25% if it's under 10,000 feet, or 10% if it's over 10,000 feet.
Yes. And our guidance does have a lot more information for owners of how to disinfect things and what kind of disinfectants. We do link to the EPA approved disinfectants, so all of that should be easy to find. And that link is, here, I will just copy and paste that link.
Yeah, and when she's doing that, we also include some ways that gyms can distance their treadmills so they're 6 feet apart, put X's on the floor so people know where they can stand and still be 6 feet apart from others. So we try to create guidance that allows people to operate in a safe way, in a way that's protecting everyone.
Let's talk a little bit about daycares and the restrictions on daycares right now.
Sure. So for daycares, not much has changed since our last guidance. Daycares can continue to be open. We are asking that daycares, or requiring that daycares maintain stable groups of 10. And so this is consistent with what we've done before. And this really goes back to our contact tracing again. So if we have a case in a daycare, we are able to just look at 10 individuals that may be potential contacts, not the entire facility. So if it weren't stable groups of 10 and we allowed all the kids to go out on the playground and you get 100 kids on the playground at the same time, we would have to do contact tracing with 100 individuals, but this way it limits it to 10.
As we're waiting for more questions, let's talk a little bit about moving forward out of this step. The order does say, and Stephanie, our director, talked about this yesterday, we're looking at about 3 to 4 weeks in between each step, depending on what results we see as far as cases and contact tracing. Can you explain a little bit why that's not an exact timeline, like why we might need more time?
Yeah. So what we need at least 1 incubation period. It's recommended nationally to have 2 incubation periods, but we're trying to go with here at least 1 incubation period to evaluate what's going on in our community if we're seeing an increase in cases. So incubation period is 2 weeks. So we need at least 2 weeks for people to get tested, and then we need time after that to get those results in. Look at the data, look to see if we are seeing a spike, or if it's looking like it's steady. And then, of course, we quickly draft the ordinance and get it out as quickly as possible. But yeah, we need at least that much time. If we're noticing some changes and we're not quite sure it's a consistent change or if it's just a random spike, that's why we need additional incubation periods sometimes.
Someone asked, what about photography studios, specifically ones that are inside? What are the rules on those?
Yeah, so we have specific guidance in our business guidance that is tailored to photography. So I would encourage the individual to look at that, but they need to maintain the same social distancing and disinfection requirements as other businesses, and it's all spelled out in there.
Yeah, I know there's a lot of things, that even as we're making the guidance, it's like, oh, people touch that and people interact that way. And it's like things that have been normal, you kind of have to think in a different way. And I think it's a good opportunity now to also describe why it's so important that people follow these rules and this guidance as we move forward.
Yeah, so it is very important for all individuals and all businesses to follow this guidance. The more that we're able to follow it, the more that we're able to practice social distancing, which includes not just the physical distance of 6 feet between people, but also disinfecting shared items, frequently washing our hands, wearing masks when we can't maintain that social distance, coughing appropriately, not coughing all over everybody, but covering our mouths with our elbow when we cough, or with a tissue and then throwing it away and washing our hands. The more we're able to do all this stuff, the more quickly we can move through our phases.
Yeah. Someone just said, thank you for explaining the timelines between steps. I know it's not exact, but it is helpful information. That's great. And then we do have that roadmap online. We're working on a graphic too to kind of help explain, we call it the roadmap to reopening, but it really is. It's going to be a journey. There's going to be some twists and turns, but we're all in this together. And I think we all want the same goal, is to eventually reopen fully and enjoy our community all together again.
Yeah, absolutely. Go out to eat, Get your nails done.
Yeah. I think we might be I'm sorry. I think we answered most of the questions in our document. Waiting for a few more, but has there been anything else that I know you've fielded a lot of questions so far since the order was announced yesterday. Are there any common themes or anything that you think business owners should know?
I am very impressed with what I have seen so far from business owners. I have had several contact me saying that they're super excited to reopen, but they want to do it safely. And some of them have not seen their exact business outlined in our guidance. And if that's the case, that is, what we're asking them to do is just submit their plan. A lot of them have created their own plans, and we can kind of fill in the gaps and help them get ready to open and do it in a safe way. But yes, I've been very impressed. I've seen a lot of people reaching out like, I'm so excited to open, but I want to make sure that my employees are safe. I want to make sure that my customers are safe, and we of course want that too, and we're happy to help you do it. So just send your guidance that you've put together to business@como.gov, and we'll look it over. We can let you know if there's anything else that's needed and get it back to you.
Someone did say, what do you think the response time will be on those plans that are submitted?
Sure. We are going as fast as we can, and we'll be working through the weekend, reviewing those as well. So I'm hoping that we have a team that reviews them, and I'm hoping that we can get all caught up to date so people have the most updated information on Monday.
Yeah. So from a business owner, they want to know, what's your advice as far as supplying masks to employees?
Sure. If it is a personal contact business, like your hair salons, your nail salons, barbers, massage, anything like that, masks are required. The cloth masks are required. We're not requiring medical grade masks just because we have a limited supply, and we do need to reserve that for our medical community. But if you can provide for those businesses, if you could provide that for your employees, and so they're not having to find their own, that would be great. It also might be a good idea to have some on hand for customers coming in. So if you are a hairstylist, you may want to have some on hand in case you have somebody come in and doesn't have a mask, and so you don't have to reschedule their appointment. You can give them a cloth mask and still be able to cut and color their hair and not disrupt your schedule.
Yeah, and we do have a little informational video on our Facebook page that shows you how to put together a mask or a cloth face covering, even if it is with a bandana and some rubber bands.
Yeah.
So really, using what you have to be able to make that.
Yeah, absolutely.
And then also, you mentioned rescheduling appointments. There is flyers and graphics that people can print off and put on their business doors that explains, if you're feeling sick or if you have these symptoms, we're going to have to reschedule. And that is linked in our business guidance as well. So there's several different resources within that document for you.
Yeah. Because we do really want to protect those individuals, because we don't want a customer who is sick to go in, get their hair done, and then that hairstylist is exposed, at risk becoming ill, and on top of that has to quarantine.
Yeah. We've talked a bit about vulnerable people who might be expected to return to work. How do you suggest they navigate that with their employer?
Yeah, so I recommend they reach out to their employer and figure out what accommodations can be made for them, because of course we don't want to have them placed in a risky environment. So reach out to your employer, talk with them. From what I've heard from employers in our community is that they're ready and willing to have those conversations, and they've already been thinking of some ideas of how they can either continue to have that person work from home or have that person work in a safe manner, which they're not around any other people. So reach out to your employer, have those conversations, and go from there.
I think that's all the questions coming in right now. Is there anything you'd like to say before we wrap up for today?
No, just continue to look at the guidance. If you have questions, email the business@como.gov. There's so many email addresses. I have to pause every time to make sure that I'm saying the right one. But business@como.gov. Feel free to email us. If you are just a member of the community and not a business owner, please remember that your part is just as important as their part. We all need to be doing everything that we can to make sure that we're keeping others safe, that we are practicing social distancing, that we are doing what we can to prevent new cases so we can move through this process and we can get our businesses eventually fully open and really feel like a little more normal.
Yeah. All right, well, thank you so much for joining us today. Thank you to Shelby, our interpreter. We will be back next week on Tuesday with another installation of Get Help, Give Help. All right, thank you.